If you're on a GLP-1 medication, you've probably heard about the incredible benefits, but also the side effects. Nausea, stomach troubles, maybe even some scary warnings. Today we're cutting through the noise. We'll explain why these side effects happen, show you the simple things you can do to feel better tomorrow, and clearly outline the rare red flags that require an urgent call to your doctor. Let's dive in. First, the science. GLP-1s work by mimicking a hormone that slows down digestion. This is called delayed gastric emptying. Food stays in your stomach longer, which makes you feel full sooner and helps with blood sugar. But that same mechanism is what causes the most common side effects: nausea, vomiting, early fullness, burping, and sometimes alternating diarrhea and constipation. The good news is that for most people, these issues are temporary. They're most common early on or right after a dose increase, and they usually lessen as your body adapts. You don't have to suffer through it. The solution is simple and specific. Tip 1. Slow and small. Smaller meals more slowly. This lowers the workload on your stomach while that gastric emptying is most pronounced. Tip 2. Reduce the fat and grease. For the first few weeks, cut way back on very fatty, greasy, or spicy foods. They take the longest to digest and can make nausea much worse. Lean proteins, cooked vegetables, and modest portions work best. Tip 3. Hydration and fiber. Stay hydrated. If constipation hits, prioritize fluids and soluble fiber. Gentle walking helps too. This is standard, evidence-aligned advice from major medical centers. Some compounded GLP-1 includes vitamin B12, which resolves the issue for some people. And here's a pro tip from prescribers. If you're struggling, talk to your doctor about starting low and going slow with your dose increases. Gradual titration is key to tolerability. Most side effects are just a nuisance, but there is a Call Your Clinician Now list. These are rare but serious, and they are listed right on the product labels. Pancreatitis warning. All semaglutide labels include this. The classic symptom is severe, persistent upper abdominal pain, especially if it radiates to your back, and is accompanied by nausea and vomiting. If this happens, stop your medication and call right away. Gallbladder disease. GLP-1 therapy can slightly raise the risk of gallbladder issues, including gallstones. Look out for right upper quadrant pain, fever, or jaundice. The risk is generally higher with rapid weight loss or higher doses. Dehydration and kidneys. Persistent, heavy nausea and vomiting or diarrhea can cause severe dehydration, which can lead to acute kidney injury. If you can't keep fluids down for more than half a day, you need medical attention. A few other points to keep in mind. Ileus and gastric stasis. Because of delayed stomach emptying, rare cases of intestinal blockage or significant gastric stasis have been reported. Watch for persistent, severe bloating, vomiting, or inability to pass stool or gas. Eye changes. For people with existing diabetes, rapid glucose improvement can sometimes temporarily worsen diabetic retinopathy. If you have diabetes, make sure your eye status is assessed when starting or intensifying therapy. Anesthesia and procedures. Most patients can continue GLP-1s before elective procedures, but if you are actively having severe gastrointestinal symptoms, your care team may adjust your fasting instructions. So what's the bottom line? GLP-1 side effects are predictable, manageable, and transient for the vast majority of users. They are a sign the medicine is working. Your best playbook is slow dose titration, lighter low-fat meals during dose increases, and consistent hydration. Stay vigilant for those red flags, keep your care team in the loop, and you give yourself the best chance to maximize the benefits of this therapy without letting side effects run the show. These are the sources we used in case you would be interested in learning more. If you found this helpful, hit the like button and subscribe for more evidence-based health content. What has been your biggest challenge on GLP-1s? Let us know in the comments below. See you next time.